Management of Controlled Substances and Diversion Prevention, Nursing Best Practice. The following information is sourced from the ANA, JAMA, and APD policies and procedures. Drug diversion is a serious matter. This is often underreported. Common drug diversion outcomes include damaged careers, civil and criminal penalties, infectious disease outbreaks, severe patient harm, and even death. What is drug diversion? It's when medication is redirected from its intended destination for personal use, sale, or distribution to others. Drug diversion is a felony that can result in a nurse's criminal prosecution and loss of license. Diversion is far-reaching, with legal and financial implications that threaten patients, medical facilities, healthcare workers, and the public. The risks to patients include unrelieved pain, inadequate care from impaired healthcare workers, and risk of infections from contaminated syringes. The risk to medical facilities is bearing the burden of fines for failed safeguards, loss of eligibility for Medicare reimbursement, and compromised public trust. Healthcare workers who divert put themselves at risk for addiction, overdose, death, criminal prosecution, and civil malpractice suits. Public health consequences include infectious disease outbreaks, increased substance use disorders, substance use deaths, hospitalizations, all of which drive up healthcare and insurance costs. Between June and October 2020, a nurse in a fertility clinic in Connecticut tampered with approximately 75% of the fentanyl given to patients. The nurse removed the medication from the vials and refilled with saline, resulting in painful procedures for more than 20 women. Between 2017 and 2018, a Washington state ED nurse's unsafe injection practices during drug diversion transmitted hepatitis C to at least 12 patients. These are just a few instances of the consequences of drug diversion. Impairment is a significant issue in healthcare. Did you know as many as 10% of all medical professionals will divert drugs from their workplace at some point in their career? The prevalence of substance use disorders among U.S. physicians has been estimated to range from 10% to 15%. Female surgeons had almost twice the rates of abuse or dependence as male surgeons, 25.6% compared to 13.9%. In the past 5 years, 2 large health systems in the United States were fined $7.75 million and $4.3 million for drug diversion incidents. Awareness and recognition of drug diversion are the first steps to prevention. Most of us have difficulty believing a colleague may be involved in drug diversion. According to the National Council of State Boards of Nursing, approximately 15% of healthcare workers will struggle with drug dependence at some point in their careers. To keep each other safe, we need to make sure that proper wasting occurs each and every time. Our policy states, controlled substances for intermittent administration not used within 30 minutes that remain unopened in the original packaging must be returned to the ADM. If the package is open, the controlled substance must be wasted within 30 minutes and action documented in the ADM with a witness. For procedural cases, controlled substances are wasted following the end of the case. When only a part of a dosage unit or a portion of a continuous infusion is used, the remainder must be disposed of, wasted, in the presence of a witness. The witness must be licensed or an approved cosigner who will observe the disposal of the medication waste and document this occurrence. Individuals licensed to waste and be a cosigner are as follows: RNs, LPNs, CRNAs, pharmacists, and providers. Our policy states, syringes, vials, sharps, and/or other disposable equipment associated with controlled substance preparation, handling, and/or administration waste will be disposed of as follows. Syringes, vials, and sharps must be discarded in sharps container after controlled substances are fully evacuated from the container and wasted in appropriate controlled substance waste container with a witness. Signs of diversion. Methods of diverting controlled substances are as follows: stealing syringes or vials, underdosing patients, replacing controlled substances with another product such as saline, taking PRN medication from patients or pulling duplicate doses, creating false verbal orders, failing to waste or document waste, or raiding sharps containers. See something, say something. Not reporting a concern could place your coworker's life at risk. Substance use disorders can affect anyone from veteran staff members to new grads, and often they are well respected and high performers. It's important to know subtle signs of diversion. Diversion behaviors. Some behavior signs include wasting complete doses, wasting no doses, or heavy drug wasting. Failure to document waste. Frequent wasting drugs that never reach the patient, i.e. dropped, refused, or discontinued meds. Repeatedly wasting with the same person as a witness. Repeatedly holding waste until the end of the shift, or carrying medications in pockets. Frequently asking colleagues to sign off on waste they didn't witness. Paying extra attention to or entering patients' rooms who are receiving controlled substances. Blaming others or the environment for errors. Deteriorating personal relationships, frequent personal crises, isolation, volatility, or sullenness. Taking a large number of sick days, arriving late to work, or frequent no-shows. Extended or frequent breaks, disappearances during shift, volunteering for overtime or coming to work on days off, reviewing the medication orders of patients not assigned to them, helping colleagues medicate their patients, or volunteering to administer narcotics to patients. Frequently asking for supplemental orders for controlled substances or pulling PRN medications. Altering telephone or verbal medication orders. Frequent charting or medication errors. Sloppy documentation, omissions, and care inconsistencies. Recurrent mistakes and poor judgment. Variable work performance. Forgetfulness, drowsiness, malaise, euphoria, anxiety, depression, insomnia, and/or paranoia. Physical signs of opioid use disorder. Some manifestations may be constricted pupils, sweating, chills, runny nose, anorexia, itching and scratching, vomiting, diarrhea, or needle tracks, blood on scrubs, around arms or legs, wearing long sleeves even in warm weather, falling asleep at work, lack of energy or motivation, forgetting routine tasks, weight loss or gain. Handling controlled substances, what you need to know to be safe. Removal of meds. Don't pull medications until they are needed. Medications that are pulled early can easily be lost or mislaid and then diverted. Do not place medications in pockets. Don't routinely pull controlled medications and hand them off to a colleague to administer. Handoff dilutes accountability. If you pull the medication, you are responsible for it. Detecting tampering. Tampering is a common method of diversion. Check for medication integrity each time the ADM bin is opened and prior to administration. Is the packing intact? If it's liquid, does the volume appear to be at the appropriate level? If it's a vial, does the top spin freely? If you think a medication has been altered or tampered with, don't touch it. Alert the nurse manager. Other ADM tips. Check for discrepancies each shift and accurately resolve discrepancies that have occurred. Log out of the ADM whenever you step away. Someone who is intent on diverting can implicate you by stealing drugs under your user ID. It's our responsibility to our coworkers and our patients to say something. Your action in reporting a concern about a coworker possibly struggling with substance use issues may save their life. You can also report a concern anonymously by calling the APD Compliance Hotline, 24 hours per day, 7 days a week, at 888-422-2984, or contact them via phone or the email address below. How to get help. The New Hampshire Professional Health Program is a free service available for self-referrals or any person concerned about licensed clinical employees. Please know that maintaining participant confidentiality is an integral element of the NHPHP. To contact the NHPHP with a concern about yourself or someone else in healthcare, you may call Dr. Rosignol, the medical director, at 603-491-5036 or the below emailed address. KGA Life Services is an employee assistance program specifically designed for the unique needs of healthcare workers. All APD employees and household members aged 18 or older have free 24/7 telephone support from professional counselors. Each person can access up to 6 face-to-face sessions per issue or concern per year at no cost. You can call 1-800-648-9557 or go to the website below with access code Dartmouth. Stay tuned to watch some examples of wasting that will follow our policy standards and prevent opportunities for diversion.